I think plastic surgeons will debate which is the best incision for breast augmentation for all of eternity. I think that there are some people who are devoutly zealous about the armpit incision, some around the areola incision, and some the underneath incision. When I first went into practice, I just said to the patient, where do you want the scar? And that's the one I'll do. Because for a long time I was really only focusing on the scar as the difference between the three procedures. But actually, I've come to realize that these are three different operations, and that the final scar is probably the least important distinction between the three. In other words, they each contact very different anatomy. One up here, you contact different nerves and blood vessels than you do down underneath. You see, if the scar with any one were always perfect, everyone would use it. And if the scar with any one of the three were frequently bad, no one would use it. So I think far too much emphasis is placed on the scar. But as time has gone on, I've read more and more data, more and more information, which suggests to me that the underneath incision is more likely to result in a longer lasting result, free from the need for revisions. It seems to have a lower rate of hardening of capsular contractures in the only study that's really looked at it very carefully compared to the other scars. And so if patients say to me, which do I prefer? I have to say I prefer the underneath incision. Today, I think the data is becoming increasingly compelling about the underneath. Now, why is that? The most common reason a woman has a revision after breast augmentation is for capsular contracture, that scar tissue that forms around the implant. The scar tissue, the capsule, is as a result of inflammation. Now, many things cause inflammation, and it seems that the most frequent cause of the inflammation leading to capsular contracture is something we call biofilm. And biofilm is bacteria on the surface of the implant, and they just live there on the implant, and no antibiotics that you take can penetrate through and kill those bacteria. And those bacteria chronically living around the implant create inflammation in the capsule around it, leading to hardening. This has been well studied now, and the world's authority on this, a plastic surgeon from Sydney, Australia, presented this data at the most recent meeting of the American Society for Aesthetic Plastic Surgery. And speaking to him afterwards, he told me he never does the areola incision. In fact, I feel so strongly now about this bacteria issue that when I do the underneath incision, I actually put a shield over the nipple, like a clear dressing, so that no bacteria that might come out of the nipple during the surgery contaminate what I'm doing. So when patients come to me, I give them a choice of incisions, but I also tell them that based on reading the totality of data to this date, it seems to me that they're most likely to have the best long-term outcome with the underneath incision.